Before we begin, cancer is a serious disease. The therapies that we're using are not yet approved by the FDA. Success with them is not guaranteed. The videos are of an educational nature and intent only. They don't establish your relationship between you and the clinic or you and myself as a provider. Please work with your own healthcare provider with your cancer journey. Thank you. Hello, I'm Dr. Mark Hancock. Today we're going to be talking about intravenous mistletoe. There's several rationales for doing intravenous mistletoe. Basically, intravenous mistletoe means that we put an IV cannula into your vein, put a higher dose of mistletoe into an IV bag, usually with normal saline, and infuse that over usually 2 to 3 hours. It takes 2 to 3 hours because of safety, but what are the advantages? Well, the effects of subcutaneous mistletoe we've already discussed, and we're really trying with subcutaneous to stimulate your immune system with often somewhat small doses of mistletoe. With intravenous, we have the opportunity to give a much, much bigger dose. And a bigger dose in terms of numbers means we might start with 1 milligram of mistletoe subcutaneously, but we'll go all the way to 100 milligrams starting off, all the way up to 800 with Helixor. And with Abnova, we might start with 0.2 milligrams subcutaneously, but we'd start with 60 and go up to 200. They're different because they're different potencies. The advantage is that tolerability, we couldn't ever give that much subcutaneous in one space. You wouldn't tolerate that. But it skips one of the immunogenic responsive areas of your body, the skin, and goes really all throughout. So in an aggressive cancer, I recommend IV mistletoe. In a cancer that is gone to other lymph nodes, for instance, or gone to stage 4, I think having a systemic treatment with mistletoe IV can be advantageous. What are some of the effects of mistletoe? There are many compounds in it. Some of them are at lower levels in the subcutaneous doses, but we're going to ramp that up very dramatically, very fast when we dose it intravenously. So, for instance, there are glycoproteins, and these are mainly the mistletoe lectins. And at high doses, they cause apoptosis in the actual cancer cells. That means a structured type of cell death, where the cell basically dissolves at the point of a tumor, and the tumor shrinks. So that is one of the favorable potential outcomes of IV mistletoe. We're ramping up the number of lectins. The polypeptides that are in mistletoe are better known as viscotoxins, and those are synergistic with chemotherapy. They're alone, they work to open a hole in the cell membrane of tumor cells, but you need enough of them to really work. They also activate immune cells, just like lectins do. Viscotoxins work on the macrophages, the lectins work more on the cytotoxic T cells, natural killer cells. You also have flavonoids that are very much like quercetin that are available in mistletoe. Flavonoids are available in tea and many other things. You also have triterpenes and all other polysaccharides. The polysaccharides are interesting because they tend to have a better effect on energy and endorphins. So you get immunomodulation from the mistletoe lectins. You get your activation of T cells and your interleukins, IL-1 and TNF alpha. We want those to be elevated. You get upregulated natural killer cells, and you get monocytes, macrophage balance. And those are modulated. You get direct cytotoxicity on cancer cells, and those are effects we want to have. And you can get neuroendocrine effects, DNA stabilization effects. So those are these stabilizing and advantageous effects of IV mistletoe. The main types of mistletoe we do IV that I want to talk about are Abnoba and Helixor. Those are two brands of mistletoe. We do sometimes do Iscador intravenously, but I'm going to make a separate video just on that. There's different nuances. What are some considerations? What are the nuts and bolts of it? Well, again, we put it in a baguette saline. It's sterile. Sterile technique needs to be used. It goes in through tubing, so you're hooked up to an IV. Can this go through a port? Yes, it can. We do that routinely. Some oncologists are of the opinion that they own your port. I don't believe in slavery, so in this clinic we will access your port if you consent to it. So the port consideration is that there is an extra fee that the clinic charges because the port access kits are expensive. We only charge that once per access, so you can stay accessed for a whole week. It can make bathing and showering a little bit of a pain, so some people will access it intermittently. But you probably know that about ports. We use the same sterile technique with the same level of healthcare professionals accessing ports at our clinic. We, of course, recognize there can be port complications such as infection, but mistletoe does not increase that risk. So that's that about ports. Otherwise, we would need to start an IV. Sometimes we don't get that on the first attempt, but our people are pretty good and we do our best. What can happen if the IV infiltrates? This is pretty rare, but if the cannula, it's a little piece of plastic, basically, a little tube, if that comes out of your vein, but still subcutaneous, and especially if you're new to getting mistletoe, and that mistletoe goes under your skin, you could get a skin reaction right there. You could even get a fever from it. That's pretty rare. We haven't seen one of those for more than a year. But if it happens, we want to know about that because we want to talk to you about you might get a fever, you will likely have a red reaction in your arm. And of course, we want to avoid that. We use Tegaderm and we tape down the IV and tell you not to run around and dance in the IV room too much with the IV. And you're allowed to do that, of course, but that's one consideration. The other consideration is how often to do these IVs. Many people ask. I like to divide most therapies in oncology into 6-week chunks because 6 weeks is enough time to see what is going to happen. Are you having a good result? Or are you not? 2 weeks is not really long enough to do that. You can get a good result and then see that later on. I've seen people feel better with their first IV. I've seen physical anti-tumor results after a few infusions. Sometimes it's really obvious. That's sort of a Christmas present to everybody. We are really happy to see that. But generally, we can really have an objective feel. And ideally, because of the half-life of mistletoe, we'd like to do it every other day, Monday, Wednesday, Friday, or at the very least, because Tuesday and Thursday, or 2 times a week, basically. That also can work. But my preference is 6 weeks of 3 times a week for an induction. If you're really coming in new to mistletoe. And the other consideration is not everyone can come for 6 weeks. I understand that these are expensive. They're not covered by insurance. I don't think you should kick yourself. I have seen results just with sub-Q, but I do think if you want to, more often, I see results with the combination. The other consideration is what if you're doing other things? And by other things, you might be doing chemotherapy. You might be able to come once every week because you live at a distance, but you'll be doing the subcutaneous mistletoe, and you might be doing other things, whether they're strong oral therapies, other integrative treatments. This goes well with those. And yes, it can be impactful to do an infusion of mistletoe once a week. It's not as strong, of course, as doing a really intensive of 3 times per week, but that's available. So there are a few different ways. I'd say that the main ones would be a 6-week induction of 2 to ideally 3 times per week. So that'd be 12, 18 infusions, or doing it weekly over the long term. Many people do IV mistletoe weekly after their induction as a follow-up, and then we might wean it to once every other week. And we might even go to once every 3 or 4 weeks if there's clearly disease stability. which you'll meet many people in the infusion room who are coming in for their once every 3 weeks, once every 4 week infusion. The other way to look at mistletoe is as a support. So many times I'm asked, I'm doing IV chemotherapy on maybe a Wednesday. What should I do with mistletoe? My consideration there and recommendation would be to do the mistletoe either that day, which is usually not possible because it's a big day, or really right the day before, because there's a synergy between viscotoxins and pretty much every chemotherapy that's been studied with them. And not just that, but there's a protective effect. So if we can protect you from the negative effects of chemotherapy, but keep the positive ones, that's one of my greatest wishes. So I do have patients that cause the IV nurses at their oncology infusion place to reach out to us and say, we have this patient that we're infusing. We know we're giving them strong chemo, but they have no side effects, or they have very few. We could barely tell. It doesn't happen every time like this, but they're very impressed that something's different with this patient. And I have to say, it's the mistletoe. Sometimes we see because there's a time when maybe the patient couldn't get the mistletoe and then they did have the side effects. So there's clearly a causal relationship. What about interactions and interference? Because mistletoe is not processed through P450 enzymes, there's generally not a drug-drug interaction, even in the IV form. There's one case report of very, very high doses, much higher than we use in our clinic, causing some liver stress, but actually it's not something that I generally see at all. So not something that, for instance, like green tea extract, that might bump liver enzymes. So not a big worry there. Would you expect a fever after mistletoe IV? Some providers think that you do, but actually, no, you don't. Generally, it'd be rare to get a fever. If we give you an Abnoba mistletoe, and there's multiple more host trees available through Abnoba, there are some very strong mistletoes through that company with very, very high lectin levels. And if we infuse high lectin levels, it's possible to get a fever that night. Maybe 5% of patients or 10% might get a fever that evening. And actually, we look at that as a good thing, but it's not expected, and it's actually pretty unusual. With the Helixor, it's much more gentle. It's a little more bolstering. The Helixor, the piney, that's the host tree, and we'll go into host trees in a separate video. That's a stronger one of Helixor. It's not stronger by far than the Fraxini of Abnoba, but you might see a fever 1% of the time after an IV. Usually the night of. It wouldn't be for multiple days. It's just an evening thing. Often there's anti-tumor response with that fever. Fever is, you'll learn, a good thing. It can be a healing thing. But don't disregard other potential sources of infection or other serious causes of fever or a mistletoe fever. Probably is not the mistletoe if it isn't in conjunction with the timing of an IV or a large subQ reaction. The other question is what could happen in a negative light as or a reaction. I'd say 5% of people on average, and with many months that go by and we don't see any, and then we have some months where we're seeing 2 or 3 people with, but on average, about 5% of people get what's called mistletoe hypersensitivity. And it's considered a pseudo allergy. That's not a true allergy. A true allergy means that you get an anaphylaxis, you have antibodies with IgE that are inappropriate, and you can have a life-threatening event. Is that conceivable, this life-threatening anaphylaxis to mistletoe? I think it's possible, but very extremely rare. If it were to happen, we would see it in the clinic during the IV, and we have epinephrine, which is the standard of care to treat that, and of course all the other emergency type things that go along with infusions. With the pseudo allergy, which happens 5% of the time, it's more of an annoying thing. We don't want it to happen, what we see is a skin reaction, not like the local one. It would be more widespread, like facial flushing and itching, maybe the thighs or the palms of the hands. So if during your infusion you feel something starting to really itch or getting a little bit irritated like that, let us know. Because it's good to stop the IV at that point and hold it, watch you. We'll get a set of vital signs. Um, Usually like swell or anything, but we want to watch that. There are some natural things. There are some over the counter, and there's some drug things to treat that. So the natural things have to do with oak, uh, and has a tannins in it, which can be very soothing and resolve allergy type things, especially in the skin. So we will do that topically a lot of times, and we will occasionally do an oak bark preparation that's a homeopathic. It's not intravenous or a sub-Q homeopathic that we give. And I've seen that alone resolve these hypersensitivity reactions. The best is if we can treat it early. The other would be with antihistamines such as Pepcid or Claritin. Sometimes we'll use Benadryl, but I typically try to avoid Benadryl because it is going to make you drowsy. Almost never need to do steroids, and only 2 or 3 times have I even used epinephrine. Maybe one of those times was it absolutely needed. So this is a pretty safe thing, but it does have its risks. Yeah, honey of mistletoe. So interestingly, sometimes people will note that an area that was like a hot area, like a root canal that went bad or was a source of inflammation, or sometimes if they get diverticulitis, they might have like one area, occasionally areas of the tumor, they may have a little bit of pain or sensation during the IV. I hear a lot from people with colon cancer or breast cancer that, or sarcoma, also lung cancer, that they feel it in their area where they know they have tumor. And that's actually a good sign. The cytokine activity really stimulating the mistletoe by the mistletoe, that's stimulating the immune cells to attack the cancer. Generally, a good correlating response is with that. That's just an anecdote, but it is something that can happen. Usually, it's not severe pain. I really haven't ever seen severe pain happen with mistletoe, but just a dull ache or a sensation, like, oh, this in my tumor is like I can feel something there. That's usually a good sign. Usually during the IV, almost everybody feels good. That's something I love about mistletoe. I can give something that when people are done with it, the IV, and they come back the next day, they usually feel really buoyed up. They feel bolstered and supported, and their energy's better. It's not a guaranteed thing, but it's something I usually observe, probably in the 90 percentile of times. Very rarely somebody has a lot happening with their immune system. The mistletoe can dead, and it's a bit of a workout, and in that case, mistletoe can be a little fatiguing. If the dose too high, or if if they're too sensitive, and we may want to adjust the dose or the host tree in that case. So if you are feeling really tired after mistletoe, maybe that it's working your body out a little too hard, and we may need to adjust that dose. And bigger isn't always better. So yeah, the other question is, can mistletoe be given in conjunction with radiation? Yeah, you could give mistletoe alongside radiation. It's supportive. It's supportive in healthy tissue to prevent DNA damage. And radiation makes tumors quote unquote hot, means findable by the immune system. So of course we want to give every ability of the body to find that tumor when it's been sort of highlighted radiation. What about scans? Depends to me. I discussed that individually. If you have a PET scan coming, you wouldn't want to just start IV mistletoe. But if you've been on IV mistletoe, I don't know that there's a huge need to hold it for weeks and weeks, maybe a week. If someone's brand new, I'd probably hold it 2 weeks. That's been my general rule. IV mistletoe doesn't generally have a contraindication or a negative effect on findings on scans. Yeah, and X, of course, there's not guaranteed effects with IV mistletoe. It's typically used as an adjunct, but you can use it as a standalone. Some people do that. And of the setting, I mean, there are that I feel like, for instance, if you look at breast cancer, if you have a stage 1 breast cancer and doing everything that you would do that for that conventionally, I think doing IV mistletoe really is a little overkill. I wouldn't normally suggest that. If, for instance, it's stage 3, I would suggest it. That means it's already in the lymph nodes. And lymph nodes mean, well, it's gotten access to sort of the body. And I would mistletoe to be able to work more systemically. Stage 4, go without saying. I would strongly recommend, if you can, do IV mistletoe. The other question, and this is a strong point in my experience, I didn't used to do this. I used to think, oh, we're giving milligrams of Helixor today. Why give another 1 milligram sub-Q? Well, because interacting with your body differently. So now I'm a strong proponent of giving both sub-Q and the IV together. Don't wait end of your IV therapy, or don't hold the sub-Q during your IV. I think do it alongside. It's completely fine. We want to see that one little skin reaction. That's useful, and then you're getting bolstered with the IV mistletoe. Yeah, so that's an important consideration. Ideally, how do we know if it's working? Obviously, if you feel better, that's a good sign. We want to follow the same things we'd follow in standard oncology. So what are your markers? If you don't have tumor markers and you have a solid tumor, we would often recommend something called Signatera, or a similar circulating tumor DNA study from a before-after. That's useful to have as a baseline. You don't have to. Scans can be looked at from before to after too. Mistletoe is one of those things that usually plays well with others. So that means you can tack it on, you can add it into other integrative therapies, or even conventional therapies. It's really warming, so it synergizes with things like sauna or hyperthermia sauna. And that's something I try to tell people. Support this whole healing process by doing warming things, including being around warm people or being warm with others, having over and having a good relationship. Also getting in the sauna, having look at your life with gratitude. I think having a gratitude journal is good. Also looking at things that you need to transform in your life. Other people you need to ask forgiveness of or give to. Forgiveness is really transformative. I think that has a lot to do with cancer healing. It has a lot to do with mistletoe. It may sound crazy, but I think many people are intuitively drawn to that. Cancer, I think everyone with a healthy habit should be looking at that at least on a regular basis. So local or whole body or getting in the sauna, those are synergistic with mistletoe. IV vitamin C, can you do it on the same day? We definitely don't do it in the same bag. I wish we could, but it really is, mistletoe's vitamin C is cooling, so we don't want to just throw it all together. We want it as a in conjunction. You can do in the morning the IV vitamin C, cooling thing, and then maybe have some ginger tea, and then go into that, have a little break, and then do your IV mistletoe. It's a long day in the clinic, but we do it. So I think this is the points of what we do with intravenous mistletoe and the reasons why we would do it. I've seen where people's cancer response from conventional things stalled out, and they were about to be switched on medication, and because mistletoe was added, things started working again. I've seen where mistletoe IVs alone, occasionally, it's not as reliable, but occasionally just the mistletoe IVs have led to an improved tumor response. I've seen PSAs go down in prostate cancer. That these videos are very helpful for you. Thank you very, very much.